Thank you. Dr. James Rota.
Thank you all for giving me the opportunity to address you to what I think is a very important subject. I am a dental educator. I've been practicing dentistry for 47 years. You asked the question, why is there not an opposition? Or why hasn't the opposition, and you will find an opposition, because what you have is an albatross. If you try to ban mercury fillings, you're going to have a problem from dentists that I taught. Because I taught that when you mix silver, tin, zinc, and copper with mercury, you had an inert mass. That ain't true, but we didn't know that. We didn't have the instruments to decide that, so I taught to the students, and it says, yeah, there's some literature saying that some people are allergic, but there's no evidence for that. And we didn't have the Jerome vapor analyzer to decide that vapor was coming out of the tooth. And mostly the diseases that are related to mercury toxicity aren't diagnosed by the dentist, they're diagnosed by the physician. And when you do a normal blood test and urine test, you don't find mercury in there. Until recently, until it's come over from European countries, until the utilization of chelating agents that forced it out of its hiding place, that made it observable for people like us who says, hey, mercury's all right, what are you talking about? We've been using it for 120 years, no one's complained yet. And why they don't complain to the dentist? Because they don't come to me with a stomach ache, they go to their physician. And the physician doesn't look into the mouth to see if mercury's in there, because we had no evidence that mercury was coming out until recently. So the opposition you're going to have are for those mercury dentists that have not educated themselves yet. I salute you for what you're doing. It's an uphill battle, but I would say one thing. You can control one thing. You can control the stuff that's coming out of the office. Because if you say right now mercury is banned, you're going to have dentists that are either going to try to take mercury out without the experience and the knowledge of how to take it out safely, and you'll have more problems on your hand, and you still have mercury going into the water supply. In my office, I have a separator that takes in, according to them, about 90% of it. Because the companies, the processes companies, the waste companies can't take it all out. And the sludge that's left over is put it in landfills, and it leaks into the water supply. So yes, you have an uphill battle, but I still salute you for doing it. But the FDA is now revisiting this subject, so you will have help. It's people like you and Costa Mesa that are standing up to this issue that are going to influence what happens in Washington. Senator Diane Watson got sick of mercury toxicity. That's why it's okay for me to talk about it. Years ago, it's unethical for me to talk that mercury was a problem. What do you mean mercury is a problem? We've had 150 years of this stuff. No one's complained yet. 80% of the populations have mercury filling, or silver fillings. We never called them mercury. That's silly. We call them amalgams, silver amalgams, even though 50% was mercury. So yes, I salute you for doing it, mostly because if your kids have an autism child, then you've got to concern yourself where it's coming from. Thank you, but I salute you.
Thank you.